I'm Laura Ward. I am a clinical nurse educator with a background in NICU and delivery team. In my current role, I educate our interdisciplinary staff and nurses about safe sleep practices.
My name's Candace Matthews, and I'm a clinical nurse specialist. I have been a pediatric nurse for 22 years. And in my current role, I work with our multidisciplinary team to help develop and create and implement safe sleep policies and practices for our organization.
I'm Leslie Kane. I am a doula and newborn photographer, and I'm also Laura's sister. I have 6 beautiful children and 6 amazing grandchildren. Our oldest grandson was born March 26th of 2021, and sadly he passed away at the age of 5 months old on August 30th of 2021. For this video, we'll call him Baby B. That was his nickname anyway. And today we're here to talk about safe sleep. My grandson, he will forever be 5 months old. He did die from unsafe sleep. Even though he had a crib at home, he was placed in a rock and play, and he was covered with a heavy quilt, 50 by 60, and a bottle was propped in his mouth for a nighttime feed, and he unfortunately died.
I'll never forget the morning that I got that call, and I wouldn't want any other family to have that call.
Absolutely. That call came in at 3:02 to me, and being jarred asleep, awake from being asleep is hard enough, but then when you're faced with he's not breathing, and hearing everything go on in the background around you. It is something that I hope nobody ever has to experience.
When we think about safe sleep, I think families are always well-intentioned and don't intend to do anything that could be harmful to their baby. And unfortunately, sometimes things don't go as planned. We may not think we're going to fall asleep. I'm going to notice if something happens. And I think this was maybe one of those times where that was probably what happened. And it's so unfortunate. And like you said, having to live through that experience as being a grandmother and just having to hear that news, that's certainly something we don't want families to have to experience.
Absolutely. It is very hard because parents love their babies. They want what's best for their babies. They don't want to put them to bed and cause those things. Mm-hmm. And so I applaud you guys for the stuff you do in clinic of teaching these parents when they leave, and even grandparents now that I'm a Mimi. It is so important to me that I stay involved with safe sleep and knowing what the new protocols are, the new boundaries, the new limits, and really just sharing that with other grandparents, because even if they're watching the baby, they need to know. You don't want to get that call from anywhere.
It takes me back to one of my NICU families. One of my whys is I was providing discharge education to a family. And unfortunately, this mom had shared with me that she was going to co-sleep. She had previously done that with her other babies. And as a new nurse, I only wish I knew then what I knew now about safe sleep, about education, about making it more meaningful and being intentional with my words and with my education. And I wish I would have dug a little bit deeper and asked what her intentions were with co-sleeping. Asked if she had a safe sleep space for her baby, because she went home and co-slept, and we received an invitation to the baby's funeral just a short while later. And she would be 11 now. And I often think to myself, what could I have done differently as a nurse? How could I have impacted that baby's life?
I think you really highlight just how important education is in the hospital stay before baby's even born, and then certainly in the hospital before discharge. And, thinking about just what an impact that can make for a family, just to learn and see the nurse or other caregivers role modeling what it means to place your baby in a safe sleep space to prevent injury. Like I mentioned with those calls that come in with our emergency response team, in the 20 plus years I've been a nurse, I can't recall a time that there was a positive outcome for those pages. And unfortunately, the majority of the time it does result in a death of an infant far too soon and unnecessarily.
Absolutely unnecessarily. And it takes seconds, minutes to where they can't be revived.
Modeling safe sleep is one of the most important things we can do in the hospital. And really, it starts prenatally, educating about myths of safe sleep and unsafe sleep, asking about co-sleeping. And so that starts early.
Yeah.
And then when they come to us in the hospital and they've delivered their baby, we've got to be consistently modeling safe sleep and correcting any unsafe sleep practices, telling about any kind of deviations to safe sleep that are often used in NICUs and special care nursery settings, PICUs, things that are medically necessary at the time, but that those babies won't be going home doing. And so we've got to make sure that we're educating nurses and other healthcare providers about evidence-based protocols, and then certainly those nurses and healthcare providers going back out and sharing with the families and modeling safe sleep time after time after time. It can't just be done at one point in time. It can't just be done within the four walls of the hospital setting.
Right.
And also being willing, either as a grandparent or a service provider, to say when something's unsafe, like a recalled rock and play. You know, parents often think, I'll watch, it'll be okay just this one time. And those things are very important for us when we know that they're unsafe to share.
It happens very quickly. And once it happens, it can't be undone.
And I think, too, in a healthcare setting where there are constantly practice changes, there's best evidence that comes out to support rationale for these changes. And in our roles as clinical nurse specialists and clinical nurse educators, it's our job to know and understand and to be able to translate that literature and information to bedside staff and to families and prepare our staff to do that. Because things are always changing, you may know what the guidelines are from 6 years ago, and guideline updates are happening all the time. So staying abreast of current knowledge and information and being able to articulate the why behind why we do these things, I think is really important for families too. And framing it in a way of not just don't do this and don't do that, don't co-sleep with your baby, don't put fluffy objects in the bed with your baby, but helping them understand the why for those things.
Now, Candace, do you have any parents that say, well, my baby's not comfortable sleeping on just that flat mattress? Because I know that was one of the reasons.
Yes. I mean, I think that cultural influences, family practices, things that get passed down from generation to generation on my baby slept well this way, my baby slept better this way. And, just I think reiterating to families that it's sometimes that deeper sleep that is more of a risk factor for infants when they are sleeping to get into a state of not being easily arousable. And again, just how that can lead to problems. And having your baby around for their first birthday and beyond is certainly, in my opinion, more important than comfort. And so just reiterating that really, truly, babies should be alone on their back, on a flat surface, in a crib, bassinet, pack and play with nothing but a single fitted sheet.
And I think, Candace, you're so right. The message is so simple. A's, alone. B, back. C, crib. When you think about educating families, it's really important to never assume that families know about safe sleep. Never assume that they have appropriate items at home for their baby to sleep in. It's very important to properly assess what they know about safe sleep. And in nursing, we call this teach back. And so asking families open-ended questions and dialogue to have them share with you what they do know about safe sleep. So asking questions like, tell me about where your baby will sleep when you go home, will elicit a much more meaningful response than, do you have somewhere safe for your baby to sleep at home?
Because her perception as a new mom is, yes, I do. My arms might be safe enough.
Or my bed is safe.
In reality, it isn't. Yeah. So I think also breaking down those barriers of how people might feel, even if we're well-intentioned, do they feel like we are somehow thinking they're less than, especially with economic diversity? As healthcare professionals, that's really important for us to break those and cross those lines. We don't want them to feel like they're less than because they don't have a certain space. So getting that conversation is really important.
SIDS and death from unsafe sleep environments can happen to anyone, regardless of your socioeconomic status.
Absolutely.
And sometimes too, just like we were talking about how literature and information changes and we need to make sure healthcare providers are aware. Same thing with families. You may be speaking to a mom that has 3 or more other children, and many things have changed within that short amount of time. And so, again, repetition, restating this information. Adult learners in general usually learn by hearing similar information repetitively to really hardwire some of those concepts. And so I do think that that's important for us to continue to assess and continue to provide education, and not just verbal communication, but also demonstrating a lot of these things. A new mom, or even a mom who's not a new mom, may need some help with a snug swaddle. And so demonstrating that to them and then letting them demonstrate to you so that you can verify they've understand the concepts and can do this at home whenever the baby's discharged.
That hands-on learning is so important, especially with unsafe sleep causing the third highest numbers of infant mortality in North Carolina. It just really begs to be taught and demonstrated well on how to prevent that.
Yeah, the numbers are staggering and sobering that, one baby dies every 3 days from SIDS or other sleep-related deaths. So, and one we know is too many.
Absolutely.
Especially when it's preventable. These deaths are preventable. As we're educating families, we want to make sure that they're aware of community resources that are available to them. It's important to screen first for a safe sleep space. And if the family does not have a sleep space at home, we can certainly connect them with resources within the community or with social work or other organizations to help provide them with a safe sleep space for their baby.
Yeah, I think also just taking time for organizations to represent themselves at community events, Safe Kids events where safety in general can be emphasized. And one of those things is, of course, sleep safety, in addition to other things that may predispose a child to some sort of injury that we can easily prevent if we have knowledge to share to families to prevent that.
There are also organizations housed within hospitals that can connect families with community resources. Some of those organizations will certainly be able to provide resources, and they can also help reiterate and reinforce education to families about safe sleep.
Now, Laura, is there a thing within some hospital settings where they can even help provide that safe sleep environment if they're unable to provide it themselves?
Oh, absolutely. In many organizations, they have social workers who can come in and help assess a family's need for a safe sleep space. And if they're unable to provide one on their own, they can work with outside organizations or other charities that are grant funded and can provide a pack and play or another safe sleep space for their baby.
I love that.
And that's
awesome.
why every baby or every family should be screened for every child less than a year. Because we don't know that there's a need unless we ask the question and can help provide those resources when available.
Absolutely.
Sharing this story and reminding families about safe sleep is very important to continue to prevent unsafe sleep-related deaths. I don't want what happened to our family to happen to any other family, and I certainly don't want any of our nurses or healthcare providers to have to experience a funeral and have to wonder if they did enough, asked enough, provided enough education, considered resources from families, like I have had to do myself.
As a grandparent, especially when you've raised 6 kids, you kind of think, we made it. We've done it. And you don't ever expect to lose your grandchild. So my why is to share his name in hopes that every baby gets a chance at their first birthday. Because he didn't get his. And I feel very inadequate compared to nurses and people in the hospital that can change and do big things and make all of the rules and help people learn. But I think sometimes it takes just a regular person for people to see that it happens to. Somebody they might know or think of, or friend, or somebody that's a neighbor that they know. And then they'll remember and they'll take those protocols more seriously. And even for nap time or walking away for a second, they'll put their baby in a safe place. Because it literally takes seconds for it to go wrong.
Death from unsafe sleep environments are preventable.
Visit safesleepnc.org for free resources, including technical assistance and trainings, along with provider and patient education materials.